Hi, I'm Nikki Priestley, physiotherapist at Physio to Live. Welcome to another stretch and release session. Today's muscle is Quadratus Lumborum, or for short, the QL. This muscle often gets short and overactive and can give low back pain and commonly groin pain, particularly with people that have asymmetrical weight shift issues, lumbar pelvic hip dysfunction, and with low back pain. So how do we release the QL? Well, before we do that, let's discuss briefly about the anatomy, because as I said, it's a deep tissue, so it differs when you're releasing this muscle. So the QL attaches to the iliac crest, the transverse processes in the lumbar spine, and then to our last lower rib. So it sits in this position, but it's deep. So we have on top of this the erector spinae, our obliques, and also a transverse abdominis. So the muscle is very, very deep in location, lateral to the spine. When you're considering releasing this muscle, what's really important to consider is what you use and then the density of the ball that you're using. So for someone like myself, this is a relatively soft roller, and the size is relatively small, so it's perfect for someone like me. And I'll explain why you need to consider the density and size when we're releasing this muscle. So how do we release it? So if we're releasing the right quad QL, you're going to find the iliac crest and then place the ball just at the top of there. Then in one motion just bridge and move over so that you can get that location, and then you'll need to relax. I'm just going to move my arm just to show you that again. So here is the ball, okay, then bridge and then relax. So as you can see, my spine is still relatively straight and I can feel that there, and then you're just going to hold that position as usual for 30 seconds up to 2 minutes until you see the tension release or the symptoms subside. So what we want to consider in relation to the size of the roller is that if we had a larger ball or it was too firm, it would cause a lordotic position. For example, if it was too large for someone like myself, it's going to create that position when we're lying, which is not ideal or safe. So when you're in this position, your spine should, as you can still see, be relatively in a neutral position. What really complements once you've released that muscle is to then lengthen it further with a nice stretch with a position called the child's pose. Okay, so this here is the child's pose position. If you wanted to increase that stretch, I'll show you on the left side for a left QL, you would then go into further side flexion. You may also then just feel the stretch coming through the latissimus dorsi, the side of the arm here. So you may want to just take that off of tension and then come into a bit more side flexion to feel that stretch in the QL. If you do want to incorporate the thoracolumbar fascia and the latissimus dorsi in that stretch, then obviously you can take the arms out and then rest down into that position. Or you can just stay in the general child's pose position, just to help lengthen those tissues. This is a great stretch, as I said, for low back pain or hip pelvic dysfunctions, and a brilliant release technique. So I think you have great results with it. Thanks for listening.